Since the discovery of antibiotics in 1928, they have become an essential medicine that has extended life expectancy worldwide. Presently, a wide array of antibiotics are used in countless applications from healthcare to agriculture to treat and prevent bacterial infections. However, this dependence on antibiotics in our world today has resulted in overuse that has created an antibiotic resistance crisis. Antibiotic resistance is among the principal public health issues, given our reliance on effective antibiotics to manage pathogenic bacteria. People are increasingly vulnerable to historically treatable infections due to multi-drug resistant bacteria and the limited discovery of new antibiotics. However, one emerging therapy that may help combat the antibiotic resistance crisis is monoclonal antibodies. Antibodies are proteins of the adaptive immune system made by B cells to fight off foreign invaders called antigens. Monoclonal, meaning single clone, describes identical laboratory-made antibodies from a single clone of a B cell. Identical antibodies are valuable because they can work together to target a specific disease. Monoclonal antibodies are produced by exposing mice to a target antigen such as a key bacteria or viral protein. The mice's B cells then produce specialized antibodies for the target protein. B cells that produce the proper antibody are removed from the mouse then fused with an immortal tumor cell. The resulting hybridoma has the antibody-producing ability of a B cell, but can also be cloned extensively in cell culture to mass-produce monoclonal antibodies. The produced antibodies can then be extracted and used to counter their specific antigen, which can include cancer cells, viruses, and bacteria. To get an idea of how antibodies can be used to treat bacteria, let's take a look back in time. The use of antibodies to treat bacterial infections dates back around 100 years. Notably, antibodies from horse serum were crucial during the 1925 diphtheria epidemic in Nome, Alaska. The heroic efforts to supply serum antibodies from over 1,000 kilometers away by dog sled saved the town and inspired the famous Iditarod race. Since then, significant developments such as the hybridoma cell cloning have enabled the production of monoclonal antibodies specific to certain diseases. These antibodies have since been proven efficacious against cancer, viruses, and autoimmune disorders. For instance, monoclonal antibodies have recently been highlighted for their role in reducing the risk of severe COVID-19. Although the application of monoclonal antibodies to treat bacteria is still preliminary, recent developments have suggested their potential in treating multi-drug resistant strains. One way that antibodies fight bacterial infection is by binding to and marking bacteria for destruction by the immune system. When an antibody binds to an antigen, the antibody's Fc region changes shape and activates the complement system, which results in a cascade of proteins and immune cells that help clear bacteria. For example, the complement system recruitment can lead to the formation of the membrane attack complex, which induces pores that cause bacterial cell lysis. Antibody coating of bacteria can also mark them for destruction by opsonophagocytosis. Here, phagocytes such as macrophages and neutrophils are recruited to bacteria by attached antibodies, enabling them to engulf and neutralize bacteria. Beyond marking pathogens, antibodies may exhibit direct antibacterial activity by disrupting essential proteins. For example, the outer membrane of multi-drug resistant E. coli is a barrier to antibiotics such as rifampicin. However, a monoclonal antibody that selectively inhibits the membrane assembly machinery of E. coli will disrupt the integrity of the outer membrane and kill the bacteria. When used alongside rifampicin, such an antibody has been shown to increase the antibiotic's efficacy by 8 times, suggesting that antibiotics may be used as an adjuvant therapy to help reduce bacterial resistance to antibiotics. Further, antibodies can neutralize bacterial exotoxins to interfere with how bacteria cause sickness. Although neutralizing toxins does not directly kill bacteria, it limits the symptoms and progression of infection while providing the host with time to mount an effective immune response. Also, by targeting bacterial toxins and not bacteria themselves, antibodies are unlikely to cause development of resistance due to the lack of direct survival pressure. To explain toxic inhibition further, we'll highlight an example of a monoclonal antibody being developed against S. aureus, a bacterium responsible for many cases of multi-drug resistant infections. The monoclonal antibody AR301 is a therapy being developed that neutralizes the alpha toxin of S. aureus to prevent immune cell apoptosis. This toxin, also known as alpha hemolysin, causes pores to form in cell membranes which can induce the death of immune cells. AR301 aims to inhibit alpha toxins so that greater numbers of immune cells can survive to fight off S. aureus. In a phase 2 trial, the antibody was successful for reducing mechanical ventilation time when combined with standard antibiotics in patients with pneumonia. Rates of S. aureus clearance were also higher compared to patients treated with antibiotics alone. AR301 has been granted FDA Fast Track designation and Orphan Drug designation by the European Medicines Agency. The Phase 3 trial is currently ongoing. Although promising results for antibacterial monoclonal antibodies have been acquired in early trials, most of these have had very limited sample size. Thus, antibacterial monoclonal antibodies need further investigation in larger Phase 3 clinical trials to better determine efficacy and safety. Although monoclonal antibodies have been developed to combat other pathologies, there remain significant barriers to the application of monoclonal antibodies against bacterial infection, including higher costs compared to antibiotics, development complexity, the need for pre-diagnosis, and few human trials. Further research into bacteria, along with advancements in diagnostic tools and larger-scale clinical trials, are all necessary to address the shortcomings of monoclonal antibody therapies and progress them to the stage of approval. However, as antibiotic discoveries struggle to keep pace with resistant bacteria, monoclonal antibodies remain a versatile tool. With the growing healthcare threat of multi- and pan-drug resistant bacteria, monoclonal antibodies may be valuable as adjuvant therapies to antibiotics in the fight against antimicrobial resistance.